myself. Additionally, I'd like to welcome any other guests we have, as well as our wonderful OAA staff members who have joined us for the meeting. So the first item on our agenda and our business is for our committee to consider a motion to approve our minutes from our January 21st meeting, and those were posted on our website as per usual. Do I hear a motion to approve those minutes, please?
I motion to approve.
Second.
Did I hear a second as well?
Yes.
Yes.
Okay, great. Thank you. All in favor of approval of the minutes from January 21st, please say aye.
Aye.
Aye. Any in opposition? Okay, those have been approved unanimously. For our next item is for us to hear the update from our Director of Operations, Charlie Linicum. Charlie, turning it over to you.
Thank you, Madam Chair. So, just wanted to give a quick update on kind of progress through our city and county grants. We have 72% of them that have returned their award packages, and funds that have been or will soon be transmitted, most of them sitting in the have been. We have 28% with some outstanding documentation requirements. This is primarily some very brand new projects that had some legal frameworks to put in place, as well as some that did not have a lot of activity in their first year and carried the bulk of their funding over. So their second year funding is contingent on them showing a certain spend percentage on what they carried forward. So but the regional coordinators and Sharika are all working diligently to make sure they have what they need, and we can keep everything moving forward. So, and then to the next item, we got all of our city county annual reports received, and the staff has conducted their reviews. 88% are compliant, which is kind of our, everything's looking good type of status. We have one, which is represented by 3%, that is in a substantially compliant. There's a small discrepancy. It's possible that as we kind of finalize everything, that they might be able to move into the compliant category if they can explain something. And then we have 9% that are non-compliant. I think it's about 2 or 3 that we're working with and trying to get some clarifications. It's likely if they provide those clarifications or some missing documentation that they would be able to move into the compliance status. And they will all, regardless of where their final status is, get kind of like a letter that kind of notes what their annual report is for, like what their kind of grade is for the last fiscal year. And if they are non-compliant, if they stay in that, then they are not eligible to like renew or receive additional funding. So, and then we received all of the progress reports for the planning grants that were issued in fiscal year 23 and fiscal year 24. With 12% that are fully completed, means they have completed their plan, submitted a copy to us, and filed an application with us for funding that was related to that plan. So we have 47% that need performance period extensions, and those are up for consideration today. And then 41% staff is following up for clarification on issues. And some of it is we're just not sure where they are with their application. They've completed their report. It's possible that by April 1st, some of these may move into the fully completed status. But everything moving along well with all of those. And then a quick update on state agency awards. We're down to only 19% where we're awaiting documentation from the agencies. 69%, which obviously is the bulk, is moving through the appropriation and fund transfer process. And most of those DBHDS is in the process of keying their fund transfers, hopefully next week. And then 8% are have been completed all the way through. We did get all the annual reports from all the state agencies, and staff is currently reviewing them, and we're following up with the agencies as necessary. And then the next proposal window is scheduled for to run mid-March to late May. I'll talk about that more in a minute. And we have a webinar for them on how state agencies can use the portal, scheduled for March 5th. So originally we had held a space in case there were some state agency amendments that needed to come through. Sometimes they they come in at the last minute, but nothing has shown up. So no items for the grants committee to consider for state agency amendments today. Then city and county award amendments. So here, this chart here is reflective of the planning grants. And so this chart is in the packet with the agenda as a part of attachment A. As you can see, we've got in the green, there is one cooperative planning grant. And the rest in the blues are all individual locality planning grants. All of them, except for the last one, have the same recommendation to extend the performance period through June of next year, with the requirement that their plan should be complete and the application for funding should be filed with OAA by the April 1 of next year deadline for the next application cycle. All of these localities indicated that would be achievable for them. With Chesterfield County, which is the last one, we have the same extension and application requirement, but they also want to amend the focus of their plan. Originally, it was to stand up, kind of to develop a plan to stand up a behavioral health facility. And that, as they have done some research into that maybe isn't the best use for their locality to do. So they want to kind of switch it to a substance use disorder needs assessment and gap analysis for their county, which is kind of the most common model here. Moving on, we have one city county amendment for an individual distribution project for Richmond City. This is just a kind of reallocation of funds within the project. There's no additional award amount. It's a youth prevention campaign. Since it has an $85,000 total award, and originally it had a number of components to develop the award and develop materials and stuff, but they have found out after reaching out to the Virginia Foundation for Healthy Youth that they have an existing program that they can push out through to their communities. And so they're pushing the bulk of the money into media buys that will increase the likelihood that more at-risk youth will see the targeted ads multiple times through multiple platforms. Now we're into new individual distribution applications. So first we have Orange County, 14,118 recommended. This is for Orange County Opioid Response Program Coordinator, which would be a part-time position for Orange County. This position is also the lead recommendation of their Epidemic Intelligence Council's roadmap, and they developed that with an individual distribution grant they got last year, kind of like a planning setup, but they just had their individual distribution funds for that. But this position will implement additional roadmap recommendations, identify priorities of community members, and work with various first responders in the county, as well as improving access to transportation, providing training for various community members and employees, and implementing a countywide media and education campaign. Charlottesville City has three projects, the first of which is an individual project for a city naloxone distribution, requesting 9,832 of individual distribution, and then 1,334 of gold standard funds. And what this project is going to do is add four doses of Narcan to AED and bloodborne pathogen boxes that already exist in 65 locations throughout city-owned facilities. And these boxes will be complete with appropriate signage and drug administration instructions in both English and Spanish. And further, the program provides naloxone to all areas where staff interact with the general public, complete with instructions and education opportunities from the city's risk management team and local CSB. And the effort will allow the city's team to be responsive in a crisis and help save lives. So the last four projects are are a bit different than most of our individual applications. So these are all still individual distribution applications. However, Charlottesville City and Albemarle County have filed separate individual distribution applications for supporting basically the same project. And you go, well, why did they not do a cooperative? And I think it's because the cost isn't very high and they can afford this on their own, and they don't want to tie up competitive dollars that might be able to be used for something else that needs more of that. So they're just handling this as separate individual distribution. But it is the first project is for jail-based Sublocade medication for opioid use disorder as a pilot project. They're working with the Albemarle Charlottesville Regional Jail. It's going to do an 18-month pilot to introduce Sublocade, which is the 30-day injectable buprenorphine treatment, and to use that in lieu of oral buprenorphine, which has created challenges related to inmate diversion. And there's the potential for gaps in dosage upon release until they can get connected to other forms of treatment. And that significantly increases the risk of relapse and or overdose. And then the other project that is with Charlottesville and Albemarle is an embedded mental health clinician at their emergency communications center. So this is with the Charlottesville University of Virginia Albemarle County Emergency Communications Center, CUAECC. I'm not even sure if it has an actual like word that you use for that that you can kind of make that sound like, but they are doing a 2.5-year pilot to embed a mental health clinician at the call center to respond to callers in crisis. So this is like to be kind of a diversion project to expand call center service and improve the region's use of emergency responders. And the project is also supported by a Bureau of Justice Connect and Protect grant awarded to Albemarle, and is expected to reach and impact over 3,600 callers over the course of a year. Are there any questions on city and county recommendations? Okay, keep going. So there was another item that was on the agenda for proposed revisions to items allowable for OAA staff approval. We are still kind of working on developing what that language looks like. And really the idea is to kind of further define what would be an administrative approval by staff that.
Hey, Charlie.
Yes. Apologies.
I'm sorry to interrupt. I'm just catching up on this. Can you go back one slide to the Charlottesville call center? So that staff member, how do we know that that staff member is dedicated just to the efforts that are our priority?
Well, one of the ideas is I think Kat is on the call and she helped worked with some of these applications. If you, Kat, I'll give an initial answer. If you have something else that you can provide to supplement, that will just go ahead and jump in. But this position being filled and focusing on this is going to be key to them being able to achieve the performance measures that they provided with this program. And so if I'll let Kat chime in as well, but if you feel like you would like us to add something else to be sure of that, we can also add a contingency that would bring in something like, what's called like time and effort reporting that a lot of places have to do, especially if they're grant funded, so that we can see that their time and effort was supported by that. We can make that like part of their annual report requirement.
So my understanding is it's a mental health clinician, so there would be calls going into the emergency communications center, and then if it was clear that it was someone who was in a mental crisis, it would be moved onto this specific individual who would only then deal with these types of situations. And of course, it is a pilot project, so I'm sure there's more parameters that they'll set out once they establish the position, but that's also something we can take into consideration.
So it's not entirely dedicated to addiction. It's a mental health, which Virginia, Brianna, our delegate Sewell can tell you, we've put a ton of money into behavioral health in the past several years because it's been a priority in the General Assembly. I'm just making sure that this, and I'm sure you all have vetted it and it's a great project, but just making sure that this is dedicated funding that meets the guidelines that are spelled out in our settlement.
Yes, and I
Agreement.
think probably a more holistic way to kind of describe this is, so like obviously if there's someone who's experiencing like an overdose, or like from one of their family members is, or something like that, or is in crisis from substance use disorder, that's obviously a direct connection. But given the language that's included with things like co-occurring substance use disorders, co-occurring mental health conditions, the way we tend to describe and coach the localities is, if someone that's calling in with some other like a different type of mental health condition, and they are able to help help this person get to some services and get some resolution to their crisis. That is, instead of it being more of a connection to, say, treatment or recovery, it's more of a prevention program, because we know that by having that mental health condition, they are significantly at risk of potentially developing like a substance use disorder, an opioid use disorder.
Right. Now, I fully understand that.
Mhm.
I just think by funding this, we may be potentially opening ourselves up to fund this throughout the Commonwealth. But they've applied for a grant, and again, you vetted it and feel confident in it, and it's a pilot project. So
Yes,
maybe
and I think that's another thing we felt, okay, because this is a pilot project, and we'll work collaboratively with them to see what the results are, and then the results of that project might be something that we could use to say, okay, here is how, based on this report here's how we can fund this for other localities, and here's how we cannot fund it and in certain ways based on what they find.
Right. Thank you. Thank you.
Mhm. Yeah, no,
Charlie, did
appreciate
their
it.
application specifically mention opioid use disorder? Because I mean, those words are not in this description, which I really feel like we need to have that.
Just a second.
Madam Chair, if I could just jump in for a second, this is Tony. Completely understand the concerns that Senator Pillion mentioned, and we're absolutely going to work toward making sure that we communicate our priorities in these grant applications. It's worth noting that this is not a competitive grant. And so when cities and counties apply to the OAA to pull down the money that they're entitled to, we're simply evaluating whether or not it meets the requirements of the settlement and state law, yes or no. We, early on, members of the Grants Committee may recall that the staff came to the Grants Committee and to the board looking for advice on how to handle projects that are crisis focused. And where does dealing with behavioral health crisis end and focusing purely on opioid use disorder begin, because there's so much overlap between the two. And the guidance that we got from the Grants Committee was to consider crisis programs that have a nexus to opioid use and substance use to be eligible uses for gold standard funds. And so that's kind of been our North Star on evaluating crisis related programs. And in fact, the Albemarle, Charlottesville area has been using some of their direct opioid funds for a variety of crisis programs. And this really is kind of a continuation of that.
Do we know what the mental health clinician, what they mean by that exactly? What credentials? Did they mention that?
Right. Do you know that? I'm trying to get the application details up now.
I'm just bringing it myself, just one moment.
Madam Chair, if I may, I know Charlie has a few more items to present to the committee, and we're not proposing any action on this yet. That would be under new business. If at your pleasure, perhaps Kat could keep researching through the paperwork and as we proceed.
That's fine. I just was curious.
No,
Yeah,
it's a great
keep
question.
going.
Yes, they provided very thorough information, and that's what I'm looking through to try to find some of the answers to your questions. It was hard to kind of distill it down to just to this level. All right, we'll move forward. And Kat, just raise your hand. Let us know if you've got something else to provide on this. So as I was mentioning before, we're looking at trying to find some language for you all to review that would kind of better solidify the things that the staff is able to approve that are kind of administrative in nature, that don't really change the nature of the project, that would warrant something coming back in front of you all to try to use your time as wisely as we can. There was some revisions made in, I believe in August that allowed us to do some of that, but we found some other situations that weren't as well spelled out. But to make sure we get the language right around those things, we want to make sure we take some time with it. So we'll bring that to you at our meeting in June. And now over to state agency request for proposals. So our proposal cycle is slated to open March 14th and run through May 27th. The grants committee meeting where the recommendations would be heard is scheduled for August 1st. This year we have 9.4 million in funds available. And that amount is, based on the measured approach that the board of directors adopted for these competitive funds. This is a higher amount. It was an increase over previous cycles due to some award reductions that happened in year 2 because of higher carry forward from one year to another than was originally anticipated. And then there was also some funding left over from some of the previous years that was not awarded. So the amount was added into this year's to be able to, because we would have expected to have sent it out a year or 2 ago. While this is not a new item, just wanted to bring this back up because it was kind of a new item last year. And when we put the request for proposals out, it hadn't been officially enshrined in the budget, but there is language in the budget for the OAA to only consider proposals from a state agency that's within the statute authority of that agency to administer. And that any awards that the OAA makes to state agencies should be considered one-time in nature and not create an ongoing obligation for the Commonwealth. This mainly centers around like establishing of full-time positions that, when the grant funds are no longer available, all of a sudden there's all these requests to the legislature just to use general funds to fund all these positions. So we've been encouraging the use of grant limited positions or contractors and wage and things like that are more short-term and temporary in nature. And then we also have a language that the OAA awards should not be used for connected to like legislative advocacy efforts in the Commonwealth. And really what we mean by that is like an award can certainly do a study of something or do a pilot to develop information that can be used by the General Assembly, the governor's office to kind of make some decisions based on evidence, but not to have an award that is, coming from us to stand a program up that is going to turn around and be, the General Assembly is going to turn around and be lobbied to now fund it with general funds on the back end, because that is not, I think, the intention of what our awards are for. And then requirements around our proposals. Obviously, the big change this year is all proposals have to be submitted through our grants portal. And is, one of the common requirements is agency have to submit a renewal proposal to continue a project into the next performance period, even if they're not asking for additional funding, because the grants committees, you guys only approve things 1 year at a time, since that's how our funding is made available and comes in. Then otherwise, these are our priority areas. We don't have any changes from the previous year. So, we're expanding, facilitating, and providing better mobile treatment, reducing overdoses, expanding access to effective treatments, supporting people in recovery, increasing treatment and recovery resources for pregnant and parenting women, as well as adolescents. And it's improving information and data sharing related to the opioid crisis, providing proactive outreach, screening, and healthcare connections, identifying and addressing needs and disparities and access to abatement efforts for people in traditionally disadvantaged communities. This is one of the things of how we have, according to the code, that we have to use to prioritize both our state agency competitive applications as well as our city and county competitive applications. And then addressing workforce needs for providing abatement efforts, developing programs to try to prevent or reduce the impact of opioid use disorder related incarceration, treatment and recovery within the foster care system. And along those lines, also increase resources for children and caregivers and kinship or fictive kinship care. And then obviously we'll also take other things that, meet the Code of Virginia and Exhibit E requirements. Any questions, thoughts, concerns on the state agency RFP proposal in priority areas?
Hey, Charlie, it's Tony. Kat was able to dig into the application from Charlottesville and Albemarle, and they specified the position in question in response to Dr. Thomason's question would be a qualified mental health professional. And so I think one of the things that we can probably do, if they're going to use the term clinician, that we'll want to make sure this is an actual clinical position. And so we can follow up with them to make sure that that's an expectation.
Get them to think and send. I'm sure they have a job description by which they can send us to make sure that it's making proper sense. Right. If no questions on the state agency stuff and no other questions on the city county items, that's the end of my report. Thank you.
Thank you, Charlie. Appreciate that thorough report. And now it's the time on our agenda where members of the public can address comments to our grants committee. And we do request your comments be limited to 3 minutes or less. If you would like to speak, if you could just click the raise hand button on your screen and our staff moderator will call your name and take you off mute or allow you to unmute yourself and enable you to speak one at a time. So if anyone's interested in providing public comment, please go ahead and proceed to raise your hand. I don't see anybody. Do we have anybody that had expressed interest for public comment that you guys know of? Okay, we will move on to new business then. All right, under our agenda, item 5.A, we're going to be considering the recommended amendments to existing state agency awards. And being that we do not have any, we can move on to our next item. And item 5B is for us to consider recommended amendments to existing city and county grant awards that were described during Mr. Linecomb's presentation and as in attachment A. I will now entertain a motion to approve the recommended amendments to the existing city and county grant awards consistent with our staff recommendations as described during our presentation and in attachment A. Do I hear a motion?
A motion would be passed.
Thank you, Mr. Tillum. Do I have a second?
Second.
Thank you, Mr. Spencer. All in favor, please say aye. Aye. Any in opposition? Okay. I heard unanimous consent for that approval. Our next item of new business is item 5.C. And this is for us to consider recommended new individual distribution grant awards to cities and counties that were also described in the presentation and are in attachment A. So I will now entertain a motion to approve those recommendations. Do I hear a motion?
A motion to approve.
Thank you, Mr. Tillum. Second.
I'll second.
Okay. Any discussion? Okay. All in favor, please say aye.
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 Any opposition, like sign? Okay, not hearing any opposition. Those are approved. And moving on to new business, item 5D. This is for us to consider the recommended state agency RFP and requirements for upcoming proposal cycle as described during the presentation. Do I hear a motion?
Also motion.
Thank you, Dr. Thompson. Do I have a second? Thanks, Mr. Tillum. I saw your hand. All in favor, please say aye.
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 Any opposition, like sign? Okay, not hearing any opposition. That has been approved. And now we are to item 5.E, where I will entertain any other items of new business or motions from our grants committee. Anyone have anything they'd like to add?
Madam Chair, if none of the grants committee members have any items, I wanted to offer just a couple of informational items for the committee.
Please, go ahead.
Thank you. The first one is, I think everyone probably has noticed that Mr. Holland, who normally is on these calls, was not with us today. He has tendered his resignation from the OAA board in order to address some personal health issues. And so when the full board meets in June, I propose that the board consider some sort of resolution of thanks and recognition to Mr. Holland for the time that he spent with the authority. And so that will be forthcoming to you. His participation and his absence is definitely noticed. The other item I have, Madam Chair, is just a follow-up on something that Charlie mentioned in his report. We try to be respectful of the committee's time. One of the challenges that we have administratively is trying to figure out exactly how much money each one of our recipients is going to have left over unspent at the end of the year, whether it's a city or county grant or a state agency grant. And so we asked them to give us an estimate as that time is approaching, give us an estimate how much money they think they will have spent and how much they think will be left over. And we use that to kind of balance our budget going into the next year and to determine how much money they're going to be able to carry over from one year to the next. And we bring that to you for approval. But then their actual expenditures tend to be a little bit different than what they predicted. And so we have to have a whole nother meeting to ask you for permission to make those adjustments. And in some cases, the adjustments are very small. But until we have this meeting and have you vote on it, we can't move forward with their award. And so this is an example of one of the types of things where we're looking for some direction as to what size of an adjustment can be made between the budget and the actual amount that was spent in the carryover from one year to the next. And so I bring this up now because we're interested in collecting any feedback that you have from us about how much flexibility you would like for the staff to have in truing up those amounts once the actual numbers come in. And so in other words, if it's within 10% of their projection, can staff just approve it? If, is that 20%? And so certainly if it's if it's a big difference between what they had projected and what the actual was, then I wouldn't be comfortable approving that. I'd want to come back to the committee, but that's the type of thing that we're looking at for June. And so if you have any thoughts on that, please feel free to let Charlie or me know what those thoughts are. That's all I have, Madam Chair. Thank you.
Does anybody have any thoughts right now about that percentage that they'd like to share?
Your experience Nice. From your experience, what is the going rate for the percentage that is acceptable for this, to you to be able to do what you need to do to knock it out and go on to the next thing on the list? Is it 15% and go for it, or is it 20? Is it 25? What is that, do you think?
Great question, Mike. I think we really want for their actual numbers to be within 10 to 15% of their projected. I think that's reasonable, but we're not making a recommendation yet. That's why we didn't put it on the agenda for today. We're just trying to gauge what would work, what would hopefully prevent extra meetings, so to speak, of the grants committee, and allow us to move forward expeditiously on these things.
Thank you.
So are you planning to bring a recommendation to us at the next meeting, then we would act on that?
At the June meeting.
Okay.
Because it won't be an issue between now and then.
Right. Okay. I also want to echo Tony's comments about Mr. Holland. He has been great to work with over the past, I guess, 3 years now, and have really appreciated his service. And I certainly want to wish him the very best going forward with his health and as he takes care of himself. So just want to share my appreciation. I'm sure that's shared by the rest of our committee and our full board as well. Anything else anybody'd like to share? I believe we have reached our last agenda item, number 6, which is a motion to adjourn our meeting. Do I hear a motion to adjourn?
I motion to adjourn. Go ahead, Tony, Timmy.
I'll second it.
Thank you guys very much. It's great to see all of you. I'm sure we're all voting in affirmation for adjournment. I will see you guys in June, if not before.
Thank you. Bye.
Thank
At
you,
the summit.
everybody.